Hi, everybody. It's Andrea with Indivisible Northern Kentucky. And 26. We're going to be asking her some questions. If you're live,
I'm running for Kentucky. Portions of everybody. The first question is, why are you here? I am 56 years old. I'm married. A couple of gone off to college, and I was coming home from work. I've been a physician, a practicing doctor for the last 30 years. I was coming home from work, and I was like, okay, now what am I supposed to do with myself? So, everybody says when you become an empty nester, you got to figure out what it is that you care about, and what are you going to do. And originally, long time ago, I had been at the University of Kentucky. I was a political science major, and I was pre-law, and I was going to go out and change the world. Those were my goals, and I spent a summer, a full summer, doing an internship at Legal Aid in Louisville, which is what I had thought I wanted to do with my life. I wanted to go out, I wanted to be a legal aid lawyer, and then eventually run for office and become a judge. And I spent a summer working on aid to families with dependent children, the sort of explaining that legislation in a way that people could use it on a day-to-day basis. And at the end of the summer, the lawyers that I had worked with had a little goodbye party for me. And at the end of the goodbye party, the guys that I had worked with all summer sat me down and they said, Karen, you can do anything you want. Don't do this. They were miserable. There was no funding for legal aid. They were all worried about their jobs. They all, really wanted to make the world a better place. And they weren't being given the opportunity to. So I listened to them, and I actually went back an entire year undergraduate, and I took all the prerequisites for medical school in 1 year. I applied to medical school, and I went, and I've thoroughly enjoyed my career. But my children are grown, and they are out of the house, and I feel like now is my time to do what it was that I had always wanted to do from the beginning.
Great.
So I applied, I actually had a family phone conversation with everybody to tell everybody, I think I'm going to run for office.
Right.
And it was my younger child, Henry, who said, Mom, if you're going to run for office, you've got to do Emerge. And Emerge is a nationwide program. It takes Democratic women. It basically trains you how to run and how to win. And nationally, Emerge has like a 76% win rate right now. So I had applied to Emerge before the 2016 election. But it was the 2016 election that really solidified in my mind that now is the time. Now is the time, and people of goodwill, people who care about other people, not people who are in this for their own self-interest, not people that are in this to divide our country, people who are in this to bring people together and work for the common good.
Right.
And I decided, if not now, when?
Right.
And that's why I'm here.
That sounds great. Right?
It would be the truth.
Yes, I like that a lot. So, okay,
Thank you.
So we're going to jump right into questions. The first one is about Senate Bill 1, which is the pensions for the state workers. What are your thoughts about the pension issue, including how they should be funded and the future of the pension system in Kentucky? Do you agree with what the governor is proposing, which is the, reform with the 401ks and things like that? If not, what do you propose?
Okay, to begin with, a pension is a promise, and it is way too important of a promise for people's health and well-being to renege on the pension. It's just not, in my mind, it's not even a possibility. And then the other thing you have to remember is that having a good pension attracts good teachers to the state. So our teacher salaries are much lower than what they should be. But one of the things that we can do to attract good educators to this state is have a good pension. And there's no way that we're going to build this state and bring it to where we need it to be without quality educators. It is, in my mind, it is an essential foundation, not just for health and, welfare, but to actually be able to build the revenue of our state, to be able to attract the type of businesses that we need to come in and hire people and grow our tax revenue. So, it's the absolute foundation. As far as pensions, as far as our current pension deficit, I feel strongly that we have to generate the revenue to fulfill those obligations.
Right.
Okay? So, what are people talking about? People are talking about increasing cigarette tax. I mean, that's a no-brainer. You can travel anywhere in the United States and cigarettes cost twice what they do in the state of Kentucky.
Right.
As far as bringing gambling into Kentucky, I'm not a huge proponent of gambling by any means, but the truth of the matter is that you're very close to home. Bring that revenue. She went to a very interesting little seminar, no-brainer. That's, Kentucky is one of the, this seminar a couple weeks ago, they were saying we're probably number 2. Okay? And if you look at what Colorado has done, Colorado is bringing in money hand over fist by legalizing recreational marijuana. If we're already producing the crop, I mean, we're already one of the top growers in the country, why not legalize it and generate the revenue from it that we could be generating? I think, one of the things I was concerned about, one of the things I still have concerns about is trying to figure out reasonable driving situations for people who've been smoking marijuana. We know without question that it's safer than alcohol. But with alcohol, we have a legal limit. If you're driving above the legal limit, then, that's not legal. I did not see good data on those same limits for marijuana.
Right.
So until we have that data, and remember, I'm a doctor, I'm used to seeing good scientific studies. Until we have that, I think I would be inclined to say, if you're going to be smoking marijuana, you don't drive.
Right.
And then that way, until we have good legal limits and we know what we're doing, but other than that, to me, it's almost a no-brainer.
Right.
It is definitely safer than alcohol. We are already growing it. We are already using it. We're spending a lot of money criminalizing it.
Right, that's another
which
issue.
we don't need to be, using our law enforcement dollars, criminalizing something that
really shouldn't be.
Really shouldn't be.
Right.
And we could bring in the money.
Right.
So, I mean, to me, that's a no-brainer. But now, you asked about a 401k type of plan for teachers.
Right.
I would only be willing to consider that going forward if, and this is a big if, we adjusted our teacher salaries to where they absolutely need to be, because you're asking them to take that risk.
Right.
And that's a big risk.
Right.
Particularly when you're factoring in the quality of the pension in their pay.
Right.
So, I mean, you would have to increase teacher salaries $50,000, $60,000 a year or even more to make it even conscionable to me that we would ask them to take that risk.
Right, because they don't get Social Security.
They don't get Social Security. This is it.
Yeah.
And, if you're going with a 401k, you have market fluctuations.
Yeah, absolutely.
You are taking a serious risk with that money. And at what we're paying our teachers, there's no way we're going to be able to attract educators to the state.
Right.
There's no way.
Absolutely.
And again, education is
key.
It's key.
Yep. So what about, talking about marijuana, some people call it a gateway drug.
There's not good studies on that, actually. There are some studies that have been published that there is a demotivational type of process that can go along with high marijuana use in young kids. The studies that I've seen so far, and unfortunately the studies that I've seen are not the best quality studies. We haven't studied the drug. I mean, there's a real problem with marijuana. It's a Schedule I drug, which is as horrible of a drug as you can get. which it isn't. I mean, it doesn't belong in
it's not
Schedule 1.
classified
No, it
correctly.
is classified totally incorrectly. That goes back, there's a long, really sort of sordid history with that is not a pretty history.
You're right.
But so it's classified as a Schedule 1 drug, which means that it's at the level of like the worst of the worst of the most addictive, and we don't have good research on it in this country. We have not been conducting the research on it in this country. So it gets a little complicated.
Right.
But as far as being a gateway drug to other drugs, the studies don't support that.
Okay.
Again, I look at this from a more scientific
Right.
point of view because that's my background.
Right, absolutely.
But the studies do not actually support that. And in fact, I mean, if you look at the cost of alcohol, as far as, addiction and abuse, those are major costs to our healthcare system.
Absolutely.
And we don't see any of that with marijuana.
Okay.
I mean, it just doesn't seem to exist.
Right. So what about the opioid crisis? There's multiple factors that are involved. Big pharma, physicians overprescribing, and the need for alternative pain medications. What are your thoughts and ideas for combating this epidemic in Kentucky?
Oh my God, that is it's such a huge and important question that I'm not even sure where to begin on that.
Right.
Okay, but I'm going to begin, since I get to talk tonight, I'm going to begin back where I was first introduced to the subject. And this was somewhere in the early 1990s. Again, I was a doctor, and for reasons that at the time were totally unclear to me, we were required. It was a mandatory requirement. All of us had to have CME, continuing medical education on opioids. Okay? And what we were told, we were sitting in these classrooms, and we were told that we were not treating pain correctly, that it was malpractice not to treat people's pain, that we had drugs that were good and safe and not addicting, and we needed to be prescribing them. I mean, we were told this loud and clear. In retrospect, it was the drug companies who were talking to us. I mean, I didn't know it at the time. I don't think my colleagues knew that it was the drug companies talking to us. I mean, we were being told that that we were responding extremely inappropriately to our patients. Now, I was in a little bit of a different position because I'd been raised by a surgeon. And he had, put it into my head from a very, very young age that you have to be very careful with prescribing pain medication because it is addicting and it is easy for people to get addicted. So I'm sitting in these mandatory classes thinking, wow, this really doesn't jive with what I've been taught. And I sort of believed my dad. So I just told myself, you know what, I'm not going to prescribe opioids. And luckily I was in a field of medicine where I didn't have to, and I didn't. But so, what happened 30 years ago is we were all taught that if you don't prescribe these drugs, you are not practicing medicine correctly. Okay? So now we go 30 years later and we have a massive opioid crisis. And then it gets even worse because then you put in what are reasonable regulations to try to limit the number of opioid prescriptions. So the prescription drugs on the street, the number of prescription drugs goes down, and then we have people who are turning to heroin because they don't have access to the prescriptions that they've been using for years. So now you've got people injecting heroin with God knows where it came from. It's mixed with fentanyl. We're having to give 4 and 5 and 6 doses of Narcan to reverse these. And I was listening to NPR in the car on the way up here. 42,000 opioid deaths in 2016 alone.
Wow.
I mean, those are huge numbers. Those are staggering numbers. So, I mean, what do we do to fix this? Well, it's first of all, it's going to take a long time because we were prescribing these drugs incorrectly. For a long time, we've gotten a nation of addicts. So first we have to do is quit prescribing these drugs and find alternative methods of dealing with pain, which we knew were there all along. I can tell you that my dad did not let people suffer. There were alternative, non-addicting drugs that you could use. There were, you give people opioids for a very short period of time, and then you switch them to non-steroidals.
Right.
And all other sorts of...
There's a way to do it.
There's a way to do it. There is a way to do it. We just were told that wasn't the right way to do it. So first, we really have to change our prescribing practices.
So would you be open to introducing legislation that would, guide physicians or make them have mandatory classes like you were in?
I mean, what you have to do, honestly, is you have to get capitalism out of medicine. It's, it doesn't mix.
Right.
There are, I believe in capitalism, but not for things like basic health care.
Right.
Because there's a dichotomy between trying to make money and trying to take care of people.
Right.
And you have got to separate those out. They don't belong together.
Right.
We should not be making money on people's health care. We should be, supporting our hospitals. We should be paying our physicians. We should be taking care of our patients. But the goal cannot be to make money.
Right.
It's just wrong. It doesn't work.
Right.
Okay? So, one, now I've lost my little train of thought, but you got to quit prescribing opioids. Okay? Two, you have got to treat addiction like the healthcare issue that it is. Okay? And it is a massive healthcare issue.
Absolutely.
And it can be treated, but you have to have appropriate treatment facilities. And then you have to figure out a way to get people to agree to be treated, because these drugs are extremely addicting.
Right.
And, very few people just say, oh, today is the day I'm going to give up,
Right.
So I am actually in favor of court-ordered treatment.
Okay.
And I'm in favor of mandatory treatment. I'm in favor of saying, either you get into a treatment program and you complete 6 months, 9 months, 12 months of treatment, or you're going to jail. Because some people need that impetus.
That push.
They need that push. But we have to have treatment facilities, and we have to have good quality treatment facilities.
Right.
And I have no objection to drug-assisted treatments as long as it's not your end game.
Right.
Because then you have people who are addicted to methadone and addicted to...
the alternatives.
Yeah, Suboxone. I feel like I'm pronouncing that wrong. But for short term, definitely to get people to the point where they're clean enough that they could start making reasonable decisions, I have no objections to that whatsoever.
Okay.
I personally, I really feel like at this point, just about everybody has somebody that they know well or somebody in their family who has, become a victim to this epidemic.
Right.
And I personally, one of my sister's daughters, started on things like Xanax and then went to the opioids, then, went to heroin. She got clean at the healing place. Okay. It took her, she was there a little over a year, and it was court ordered.
Okay.
And she knew, if she walked out, she was going to jail. But she's been clean now, 3-4 years.
That's great.
Finishing up her education, has her child back. I mean, she's living a real life.
Good. Yeah.
So there is hope on the other side.
Right.
You can get clean and you can, pick up where you left off. So, when you're losing 42,000 people a year, it's definitely worth having treatment. If you court order somebody to treatment and there are no treatment beds,
right,
that doesn't do anybody any good.
Exactly. Absolutely.
And these have to be good quality, not-for-profit treatment programs so that people have a chance.
Right.
And you got to understand, it's not like... sometimes I think our governor thinks if you get addicted, well, you're a bad person. or you made your own bed, you should sleep in it, or you must be weak.
Right.
That is not the truth.
Right.
These drugs are horribly addicting. They will take happy, healthy, normal people and take them down.
Yep.
So, I mean, did I answer your question?
You did. You absolutely did. It was a great answer. So let's go into healthcare then, since you've worked in healthcare. What are your thoughts on the state of healthcare right now? And there's talk of, there's a push for single payer. Do you think that would be a good idea? And then there's the whole issue with the Medicaid expansion that the governor wants to. And how do you feel about people being pushed off healthcare and how that will affect our state?
I think that under our previous governor, under Governor Beshear, Kentucky was able to really be a model for the entire nation as far as healthcare expansion.
Right.
And we saw hundreds of thousands of people in the state of Kentucky get access to healthcare who had never had it before.
Right.
And it was working. It was working for the patients, it was working for the hospitals, and it was working for the doctors. Because you might not be getting paid as much as you used to get paid, but you were getting paid something. You had patients who had access to health care besides just walking into an emergency room.
Right.
And if you walk into an emergency room, you'll get taken care of because by law they have to take care of you. But by law, they don't have to provide follow-up for you. And they don't have to provide medication for you.
Okay.
And you need, a semi-elective surgery. They don't have to schedule that surgery for you. You need chemo. And, I mean, we have patients walking in, you are calling around like a desperate person trying to find anybody who will take this patient and take care of them. And then we have this amazing Medicaid expansion that came into the state, and we didn't need to be calling around like desperate people. You had patients who could be admitted to the hospital, who could see a doctor in the office. It was wonderful. And now Bevan is intentionally, on purpose, going to be spending millions of dollars more to intentionally disenroll hundreds of thousands of people from their health care.
Right.
And it is not only wrong morally and ethically, it is a bad fiscal decision. Our rural hospitals are going to close. The ones that haven't already closed are going to close. And then we're going to have massive expanses where people have no access to health care. There may be an 80-something-year-old, family practitioner who's still in the neighborhood, but there's going to be nothing else. And you're not going to be able to bring new people out there because there's going to be no facilities to support them. Okay? So it's bad for the hospitals. It's bad for the patients. And it's fiscally unsound because, first of all, you're going to be spending millions of dollars of money to do this. But second of all, like I keep telling people, it is less expensive to treat somebody for high blood pressure than it is to pay for them to be on dialysis because their kidneys have shut down from their high blood pressure. So it is, it is fiscally irresponsible every way you look at it. Now, what's the answer? Well, the answer at this point is we are going to have to go to a single-payer system because the healthcare delivery system is so broken that there is not going to be another option. So that people who have, historically been able to pay, a private carrier for their health insurance aren't going to be able to afford to do it anymore. And even if you could afford to do it, the co-pays and deductibles are going to be so high
deductibles
that you're not going to be able to. And if our federal government and our state government continues to destroy the advances that the ACA made, there's not going to be another choice. And personally, I'm a doctor. I have been calling physicians all over this state because I need to raise money for a campaign. Now, I will tell you, I'm calling Democrats. I'm not calling Republicans right now, but I'm calling Democrats. I have not talked to a single doctor who doesn't agree.
Absolutely.
We all agree. We all saw what the ACA could do. We all are seeing what our current governor is planning to do, and we all know this is not going to work. This is not going to work, And it's just wrong.
We need something else.
We need
this
something
is not the way to
else.
go.
Yeah.
Absolutely. Okay, let's move to higher education. These costs are skyrocketing. The average college student ends up tens of thousands of dollars in debt upon graduating from college. I mean, you went to medical school. You know how expensive that is. Do you have any solutions for this crisis? How can the Kentucky government support our students in their pursuit of higher education? So they don't come out of school with these massive loans, and then they can't buy houses. They can't. They,
yes.
know,
that basically drag you down for the rest of your life.
Right. At least 10 to 20 years you're paying these. So how can we support them?
It's a really tough question.
I know.
It's a really tough question. I mean, I can tell you historically, like my parents were raised in New York, and if you had good enough grades, you went to college at no cost.
Wow.
And that's how, I know that's how my mother got through school. Now, my dad came down to Louisville. I think he probably actually paid, but I know my mother and her brother, I mean, that's how you got your education, was you worked hard enough in high school that you had the grades that you could be eligible for free college.
Right.
And I think that without programs like that, we're basically further dividing our country. We're dividing our country into those people who have money and those people who don't. And the American dream, is that you work hard and you get ahead and you get your education and you start a family and you buy a home and you become an upstanding citizen. And if we don't have that opportunity for people, then we're not going to have the democracy that we want and need. Right. So we have to figure out a way to do it. And other states are doing it.
Right. There's other states that are
other
offering.
States that are already offering free college. So it's doable.
Right.
It is doable. And in the long term, again, when you have a well-educated population, then you can attract the type of businesses that you need.
Right.
I mean, it's not like we're out of room in the state of Kentucky. We're not out of room, okay? So, and you can say things like Amazon. Did we want Amazon? Did we not want Amazon? I don't care if you wanted Amazon or not. Amazon didn't want us. And the reason they didn't want us is because we don't have enough of an educated infrastructure. So it seems to me that if you're going to build towards the future, you pretty much have to.
Right. Right. We need to support that. So let's talk about right to work, if you're familiar with that.
Yes, very familiar with right to work.
We're a right to work state now, which is anti-union, basically.
Yes.
What are your thoughts on Kentucky adopting a right to work environment, and how would this affect union jobs and workers, and how does this affect the state of Kentucky, basically?
Well, not in a good way. I mean, basically right to work is, as they say, it's right to work for less. And it is very much anti-union legislation that supports corporate America. It supports the people who have money and pits them against the laborers in the unions, which is supposed to be a check and balance for our society.
Right.
So basically what you're doing is you're taking away that check and balance. You're further dividing people, and you're undermining our democracy again. And states that have right to work legislation are some of the poorest and least educated states in the country. So why would we want to move backwards? What is the purpose of us moving backwards? Again, you have to support your unions. You have to support it. It's supporting the integrity of society as far as I'm concerned.
Well, they've done so much for us, They've done so much for us, for all workers. Why why would we want to?
I mean, if you go back and you study history, and you start off, with the sweatshops and the fires and people getting hurt and people getting basically used by their employers over and over again. There was a whole movement that changed that for the better.
Right.
Why would we want to go backwards? To me, it makes no sense.
So would you support, if you were elected, you would repeal the right to work? It sounds like you would.
Absolutely support repealing right to work, and I would absolutely support prevailing wage legislation.
Great.
Prevailing, wage. It's, again, we want to move forward as a state.
Right.
We want to bring ourselves up together, and this is working in the opposite direction.
So minimum wage, Senate Bill 17 would increase the minimum wage for many workers to $10 per hour by 2020. Do you support this, and do you think it's enough? Some people may not even think that. That's
I haven't actually looked at the data on what is a living wage in Kentucky, because it varies from state to state, and it's so. I would want to know what a living wage actually is in the state of Kentucky, but there is no way that you can expect people to work full time and not bring home enough money to feed themselves and their children.
Right.
It's not even. It's unconscionable as far as I'm concerned. So whatever that rate needs to be to support a living wage, I would be in favor of that.
Okay, great. Some people have said, though, that it would hurt small businesses if you did it right away. How do you think that would work? Would you be in support of legislation that maybe did it incrementally, or you would look at certain industries in the state, like Walmart probably wouldn't have a problem with it, but some of the other smaller businesses might? And not.
Again, I would have to see some good, solid data, but my take on that is that you have to be able to pay your workers a living wage, or else your business isn't solvent anyhow.
Right.
So I am not convinced that I would be wanting to
exclude certain
rights. If your business is working and you're making a profit, then you should be able to pay your employees.
Right.
And if you're not, then you probably need to rethink your business.
Okay. Okay. House Bill 372 is an anti-marriage equality bill, which would allow social service and housing discrimination against same-sex married couples. If you are elected, what would you do to ensure that Kentucky does not discriminate against anyone, regardless of race, religion, or sexual orientation?
Okay, this is a subject that's very near and dear to my heart. All right. I am solidly in favor of a statewide fairness ordinance that would protect regardless of your sexual orientation or gender identity, would protect you in your job, in your living arrangements. Like Chris Hartman says, you can get married on Sunday and fired on Monday. and this is not just, this is very personal to me because I have gay children. So to me, this is an extremely personal matter. But it's not just personal because, again, what we want to do is we want to make Kentucky a state that is attractive to businesses. And companies like Amazon and these bigger, higher revenue-generating companies don't want to bring employees into a state that they're not going to be safe and protected and feel comfortable and welcome.
Right.
So it's not just that I want my own kids to be safe. I want Kentucky to be a state that people don't look at and say, why would we even think about it? Right.
Yep.
So it's a very important issue. And
It obviously affects more than just housing. It affects Kentucky's economy, basically.
It does. It affects the economy significantly. And I mean, we've seen how people have reacted, to places like North Carolina and how many companies have said, no, we're not interested.
We're not going there.
We're not going.
Yep.
Because their employees care. And people do care about this. And, Kentucky's, I think we have it's either 7 or 9 cities now that have their own fairness ordinances. But there's nothing to protect any of those from the state overriding them.
Right.
So, as far as I'm concerned, this is legislation that Kentucky should have passed a long time ago.
Okay, that's great. Okay, we're going to talk about reproductive rights.
Getting me started again. Okay.
Many bills being presented in the legislature right now would limit women's reproductive health rights. We feel like we're under attack, basically, all of these bills that they're putting through. What is your stance on a woman's right to choose what's best for her reproductive health? Here in northern Kentucky, St. Elizabeth has taken over our healthcare system, and they will not perform some procedures due to a Catholic belief, such as tubal ligation. So what's your stance, and how would you, what's your opinion on this issue?
All right. Okay. First of all, I'm going to start by saying that I am an extremely strong believer of separation of church and state, okay? And I think if you separated your church and state, you wouldn't even be having to ask me this question. Because whether or not you think abortion is okay is a very personal, in many cases, religious decision. And if you don't believe in abortion, then by all means, do not have one. But just because you don't believe in it doesn't mean that it's not the appropriate decision for somebody else. Right. And you shouldn't be putting your religious beliefs in the legislature. You should be putting your religious beliefs at home, around your dinner table, in your church, with your family, with your friends, but not making laws based on that. Right. Okay? So I believe that every woman should have the right to make this decision with her healthcare provider, her significant other, her family, her friends, whoever she needs to reach out to make that decision. But if she decides that for some reason aborting a pregnancy is the correct decision for her, then our job as legislators is to make sure that she has access to safe, legal women's health care.
Right.
Okay? So what our governor is doing, which is spending our taxpayer money trying to close the last legal abortion center in the state of Kentucky on a pretense. It's an absolute pretense, because he's saying, that you don't have a transfer agreement. You don't need a transfer agreement. There are like 3-4 hospitals within blocks of this center that are open and cannot turn a patient away.
Right.
Okay? So I think it's unconscionable. And I really want to be able to stand up and say, you are putting women at risk.
Right.
Because I'm old enough to remember quite clearly that if you had the money, you could go to New York or you could go to Michigan and you could get a safe legal abortion. But if you didn't have the money, you ended up in the emergency room with a perforated uterus or uncontrolled bleeding or pelvic inflammatory disease because you did the only option you had.
Right.
And, Roe v. Wade, since 1973, has been the law of the land. Right. And our job is to make sure that women who make that choice have access to safe, legal health care.
Right.
And, if you look statistically, if you look at states that have closed their abortion centers, their maternal death rates are significantly higher.
Right.
And it's because, or partly at least because, you are taking women who are not in an appropriate position to have a child, and essentially forcing them to have a child.
Right.
And you're not giving them access to health care. So it's not like you are going to help them get to an OBGYN
Right.
and get prenatal medication and get adequate nutrition and have a safe home environment. You're not doing any of that. You're just basically forcing them into a very difficult and unhealthy position for them to be in.
Right. Absolutely.
And again, I think that's wrong.
Yep. Absolutely. Okay. We are going to talk about guns because that is hot topic right now in Kentucky, right?
Yes.
So
Nationally.
nationally, absolutely, yes. But a lot of the Kentuckians have a high ownership of guns here, so I think it's something on everybody's mind.
Something that people care about.
Right. Should Kentucky have stricter gun ownership laws? And do you think assault rifles should be banned?
Okay, yes and yes. We'll start off just answering your questions. Okay. So, I understand that there is a Second Amendment, and I understand that people do have the right to bear arms, and I actually understand that there are people who feel like their right to bear arms is being threatened. Okay? But there is nothing in the Second Amendment that says you don't have to be licensed or you don't have to be registered. There is nothing in the Second Amendment that says you can't wait 3 days for a background check. There is nothing in the Second Amendment that says we have to sell semi-automatic rifles, literally in stores right down the street so that anybody who wants one can go pick one up. So, if you ask me, we are way past time where we need to do something to stop the gun violence that this country is having to deal with at this point.
Right.
So I am in favor of licensing and registration. I am in favor of background checks. I'm in favor, actually, of mandatory state reporting to a federal depository so that we know who should not be sold guns to. Okay?
Right.
I'm in favor of banning the sale of semi-automatic rifles. We don't use them for hunting. You don't use them to protect yourself at home. They're used to kill people.
Right.
And we had a ban on them. And then we unbanned them.
Right.
And now we're having a national crisis where our kids are literally scared to go to school, and with good reason. Yes, you have a right to bear arms, but that doesn't mean that we don't have a right to make sure our citizens are safe. I mean, cars are registered. You have to be registered to vote.
Right.
It's not like we're not used to, as a society, requiring these type of safe checks.
Absolutely.
And if we're going to get it done, the time is now.
Right.
Because we have these young people who are speaking loud and clear and telling our country that they've grown up being scared.
Right.
And they don't want to be scared anymore.
Right.
And I was out there yesterday in Louisville. It was pouring rain.
It was snowing here.
Cold.
Yeah.
But there was nothing that was going to keep me from being there. Because we have got to listen to these children. We have got to support them. And, if not now, when?
Right. Absolutely. So how do you feel about arming teachers? So there's a program out there. It's called Protecting Our Students and Teachers, and they want to arm teachers in our schools, basically. So how do you feel about that, and do you have some alternative ideas if you don't believe in that?
Okay, first of all, I've been making lots of phone calls, doing lots of door knocking. I have yet to talk to a teacher that wants to be armed.
Right.
Okay? I mean, it's a bad idea from beginning to end. Statistically, a gun owner's chance of getting killed by their own gun are 5 times higher than their chance of being killed by an intruder. Now, those statistics are old and they come from home ownership, but they would apply to schools as well.
Right.
You know, you're going to ask your teachers to learn how to use this gun, and then in the face of the scariest, most dangerous situation they've ever been in, use it correctly and don't hurt good people with it.
Right,
it's not possible. I mean, even trained police officers and trained security officers don't think this is a good idea. And I mean, like we saw in Parkland, aren't always in a position to respond appropriately. And these are guys who are trained and have been trained for years. Right. So what is the option? I mean, first of all, the option is get the guns off our streets. We have way too many guns available in this country. I would not, be opposed to having metal detectors at schools. I would not be opposed to having bulletproof glass at schools. But that is not the solution. I mean, that is a stopgap measure to keep people from getting into the schools that have guns and shouldn't be there. I mean, ultimately, the solution is going to be to have a country where the only people that have access to guns are those people who are mentally well and are trained and are safe and are responsible gun owners.
So talk about the mental health part, because that's what a lot of people say. It's not the guns, it's the mental health. And how do you...
It's very much both.
Right.
It's very, very much both.
So how do we address that mental health part of it?
It's a tough question. I mean, one thing we do, honestly, is we get a nationalized healthcare system, and we include mental health in that system. But even then, you cannot predict who is going to go crazy.
Right. It could be their life situation at the time.
Right. I mean, we know things like that domestic abusers are, probably honestly should not own guns because of the incidents of spouse abuse and spouse killing.
Right.
And, I mean, things like, people who are actively schizophrenic, people who have clear anger management disorders. But even then, how do you identify them? And how do you get them? It's an overwhelmingly difficult subject.
Right.
And the truth of the matter is, if you don't have a gun, you can't walk into a room and mow down people. Right. So, I mean, yes, we have to support our mental health care workers. We have to get a higher quality mental health care system in place in the United States so that people have access to health care. That's not going to solve the gun problem. Right. That's going to be a drop in the bucket for the real problem.
Yeah, it's almost overwhelming to even think about. But
it is overwhelming.
It's got, multiple parts to it that we can't just address one part of it. We have to address all of them.
All of it together.
Yeah, it's a challenge. So, okay, so we're through our questions, and we through our time.
Quick.
I know. Well, when you're having fun, right? Time flies. So if you'll just the last couple minutes here, just talk to our audience again and just tell them why they should vote for you.
Hi, guys. Okay, so why should you vote for me? I consider myself socially progressive, fiscally extremely conservative. I only want to spend money where I know that it is going to have an impact and where I know that it is needed. But I also think that one of the things that our government needs to be doing and should be doing is working to bring people up. A society where you have people who have and you have people who have not is an unstable society. And what we're supposed to be doing as elected officials is working for the good of our electorate. We're not supposed to be working for our own personal interests. We're not supposed to be actively trying to divide our society. We are supposed to be working to bring people together and bring people up together. And I can promise you, as a candidate, I am beholden to no one. There is nobody who can influence me in the decisions that I'm going to make. I am an educated, democratic woman who wants to work for the good of all. And, I think that the women are going to be the ones that do this because we're more used to consensus building. We're more used to working with people that we don't necessarily always agree with for the good of the whole. And I've never considered myself a feminist, but I really think the time is now that we need to elect people who are going to work together and are going to work together for positive change. So thank you for your time, and I really appreciate you listening to me. And please get out and vote because, 18% of the population elected our current governor, and we are in a real mess as a result. And I think if people of goodwill stand up and stand together, we can have positive changes. And I think we have to start working at the local and the state level and then move towards the national level. And we can do it. And 2018 is going to be the time to do it. And we're going to have to do it together. So thank you, and thank you very much for your time.
Great. Thank you so much, Karen, and good luck.
Thank you. Thank you.